June 2nd, 1948. Landsberg Prison, Bavaria. A man walks toward the gallows. His name is Karl Gebhardt. He's 50 years old, a decorated surgeon, former president of the German Red Cross, personal physician to Heinrich Himmler. In another life, in another Germany, his obituary would have celebrated surgical innovations and lives saved. Instead, history will remember him for something else entirely. For operations conducted without permission. For wounds deliberately created, not healed. For transforming 74 healthy young women into medical experiments using scalpels, bacteria cultures, and broken bones. The judges who sentenced him to death didn't focus on the number of victims. They focused on something else, the surgeries themselves. More than 250 separate surgical procedures documented in meticulous detail, each one unauthorized, each one designed not to save the patient, but to generate data. And here's what made the evidence impossible to deny. Gebhardt kept records, typed reports describing which bones were removed, which muscles were severed, which wounds were deliberately infected and with what bacterial strains, photographs showing legs open like medical textbooks, and testimony from the women who survived, who could point to scars and say that surgeon did this to me while I was chained to an operating table. This isn't just another story about Nazi atrocities. This is about the moment international law recognized that a medical degree doesn't grant permission to cut into human flesh, that operating rooms can become crime scenes, that surgeons can be murderers, even when they wear sterile gloves and document their work in peer-reviewed journals. Today, I'm going to walk you through exactly what happened in those surgery rooms at Ravensbruck concentration camp between 1942 and 1943, how the experiments were justified, how they escalated from infections to amputations, and how 5 years later, the surgical records became evidence that sent 3 doctors to the gallows and established a principle that governs medicine worldwide. Consent isn't optional, it's the line between healing and assault. So the question isn't whether crimes occurred. The evidence made that undeniable. The question is, what made these particular surgical experiments so legally significant that they helped birth the Nuremberg Code and every medical ethics framework that followed? Stay with me, because by the end you'll understand why operating without consent became an international crime. But first, we need to go back to May 1942, to an assassination in Prague that set everything in motion. Before we continue, if you're interested in deep historical analysis of World War II war crimes, trials, and the legal decisions that shaped modern justice, I'd appreciate if you'd subscribe. It helps the channel grow and lets me know this content matters to you. And as we go through this story, drop a comment with your answer to this question. If a doctor operates on you without permission, even if the surgery is technically successful, is that medicine or assault? Where's the boundary? I read every comment, and I genuinely want to know what you think. All right, let's get into it. May 27th, 1942, Prague, Czechoslovakia. Reinhard Heydrich, architect of the Holocaust, is wounded in an assassination attempt. Shrapnel from a British-made grenade tears into his body. Heinrich Himmler immediately dispatches his personal physician to save Heydrich's life. The physician is Karl Gebhardt. Gebhardt examines the wounds. They're serious but survivable with proper treatment. There's a new drug available, sulfanilamide, an early antibiotic showing remarkable effectiveness against infection. Allied forces are using it. German military doctors are testing it. Gebhardt has access to it. He chooses not to use it. 8 days later, Heydrich dies. Blood poisoning, septicemia, an infection that spread from wounds that could have been treated. Questions immediately arise within Nazi leadership. Why didn't Gebhardt use the sulfanilamide? Was it medical incompetence? Deliberate negligence? Gebhardt's career? His reputation? His position within the SS hierarchy? Everything is suddenly at risk. He needs to prove something. He needs to demonstrate that sulfanilamide wouldn't have saved Heydrich, that the drug is unreliable, that he made the correct medical decision. But there's a problem. Proving a drug doesn't work requires testing it, and testing it properly requires infected wounds on human subjects. Not animal models, not laboratory simulations, actual battlefield-style injuries on actual human bodies. Gebhardt goes to Himmler with a proposal. Let me conduct experiments at Ravensbruck. Let me create wounds, infect them, test whether sulfanilamide actually works under combat conditions. Let me prove I wasn't responsible for Heydrich's death. Himmler approves. And that decision, that approval, sets in motion a series of surgical procedures that will later be described in a courtroom as systematic mutilation disguised as research. Here's what you need to understand before we go further. This wasn't a rogue doctor conducting secret experiments. This was officially sanctioned research coordinated with the highest levels of Nazi medical administration. And that coordination created something prosecutors would later use to devastating effect. A paper trail. Ravensbruck concentration camp, located 50 miles north of Berlin. It's primarily a women's camp housing political prisoners, resistance fighters, Jews, Romani, Jehovah's Witnesses. By 1942, the camp holds thousands of women in brutal conditions: starvation rations, forced labor, routine violence. Into this environment, Gebhardt brings his team: Dr. Fritz Fischer, his protege, a young surgeon eager to advance his career; Dr. Herta Oberhäuser, one of the few female Nazi physicians, who will personally administer anesthesia during operations; and a support staff of nurses, orderlies, guards. They set up in the camp hospital. They requisition surgical equipment: scalpels, bone saws, bacterial cultures, suturing materials, medication for some operations, but not others, because part of the experiment is seeing what happens without treatment. And then they need subjects. The SS administration provides them: 74 young women, mostly Polish, most arrested for resistance activities. Their ages range from 16 to 40. They're healthy, or as healthy as anyone can be after months of camp conditions. That's important. Gebhardt needs baseline health. You can't test wound healing on someone already dying. The women are told they're being transferred. Work detail, kitchen duty, something routine. They have no idea what's actually about to happen. The first operations begin in July 1942. Here's how the initial experiments were structured. 5 women at a time, they're brought to the surgery room. Only then do they realize this isn't work detail. There are operating tables, surgical instruments, doctors in white coats. Some women are given anesthesia, others receive only partial sedation. A few receive nothing, held down by guards while surgeons make incisions. The procedure follows a specific protocol: an incision 5 to 8 centimeters long, 1 to 1.5 centimeters deep, cut into the leg, usually the lower leg, the area around the fibula. Then bacterial cultures, mixed with dextrose to create an infection medium, are spread into the open wound. The wound is sutured closed, and then the doctors wait. The infections develop within days: fever, swelling, red streaks spreading from the wound site. This is what Gebhardt wants to observe. Will sulfanilamide stop the infection? Under what conditions? At what dosage? But here's where the experimental design reveals its true nature. Not all women receive treatment. Some are given sulfanilamide immediately. Some receive it only after the infection has progressed. And some receive nothing at all, left to see whether their bodies can fight the infection without intervention. The untreated women suffer. Their legs swell to twice normal size. Pus drains from the wounds. Some develop blood poisoning. 2 die within the first month. Gebhardt takes notes. Fischer photographs the infected legs. Oberhäuser monitors vital signs. Everything is documented. Which bacterial strain was used? How much? How long before symptoms appeared? Whether the patient survived? And here's what makes this particularly significant for the later trial. The surgeries weren't improvised. They followed a systematic protocol. Each operation had specific variables being tested: bacterial concentration, wound depth, treatment timing. This was designed research, not random brutality. The documentation would prove that. September 1942. The infection experiments have produced data. Gebhardt is preparing to present findings to German military medical conferences. He's arguing that sulfanilamide is unreliable, that his decision not to use it on Heydrich was justified. But questions emerge. Critics within the German medical establishment point out a problem with Gebhardt's methodology. The wound infections at Ravensbruck don't accurately replicate battlefield injuries. Combat wounds involve more than bacterial infection. They involve trauma, crushed tissue, broken bones, foreign debris driven into muscle. If Gebhardt wants to prove sulfanilamide wouldn't have saved Heydrich, he needs to create wounds that more closely match what Heydrich actually suffered: shrapnel injuries, bone fragments, muscle damage. So the experiments escalate. The second phase begins in November 1942, and this time, the surgeries go deeper. Fischer leads most of these operations. The procedure becomes more invasive. Women are brought to the operating table. Anesthesia is sometimes provided, sometimes not. Incisions are made in the leg. But now surgeons go further. They remove sections of bone. Tibias and fibulas are cut out, creating gaps in the skeletal structure. Muscles are severed. In some cases, entire muscle groups are extracted. Then the wounds are contaminated, not just with bacteria, but with foreign material: wood splinters, glass shards, metal fragments, recreating the chaos of battlefield trauma. The wounds are sutured closed, and again the doctors wait and observe and document. The women suffer in ways that go beyond infection. Legs that can no longer bear weight, permanent nerve damage, chronic pain. One woman has 6 centimeters of bone removed from her leg. She will never walk normally again. The number of operations multiplies. Some women undergo multiple surgeries, not because the first operation failed, but because Gebhardt wants to test different variables, different bacteria, different wound depths, different treatment protocols. By early 1943, the surgical count has exceeded 200 separate procedures on 74 women. Some victims have been operated on 4 or 5 times. Their legs are maps of scars, each one representing a different experimental protocol. But the document that will later destroy Gebhardt's defense isn't a confession. It's a spreadsheet, A typed table listing every operation, date performed, subject number, procedure type, bacterial strain used, treatment administered, outcome, all organized with bureaucratic precision. That spreadsheet, entered as Prosecution Exhibit 224, will later be displayed in court. And when defense attorneys try to argue these were legitimate medical experiments, prosecutors will point to one column, the column labeled Consent Obtained. Every single row in that column is blank. The women being operated on aren't passive victims. They resist in the only ways available to them. They warn each other when SS guards come to select the next group. They share information about which doctors are most brutal. They try to care for each other's wounds despite having no medical supplies. And they give themselves a name, Kaninchen, rabbits, because that's what they've become, laboratory animals bred for experimentation. One woman, Władysława Karolewska, refuses to walk to the operating room. Guards drag her. She fights on the table. It takes 3 people to hold her down while Fischer makes the incision. After the surgery, her leg is so damaged she can't stand. Guards beat her for not returning to work fast enough. Another woman, Jadwiga Dzido, is subjected to one of the most severe operations. Bone and muscle are removed. The wound is infected with multiple bacterial strains. She develops gangrene. Camp doctors recommend amputation. Gebhardt refuses, not out of mercy, but because he wants to observe whether the infection can be reversed with treatment. Dzido survives, barely. Her leg remains attached, but the damage is permanent. Years later, she will stand in a Nuremberg courtroom and roll up her pant leg to show the judges what German medicine did to her. The women begin to realize something. The SS is planning to kill them. Can't let them survive the war carrying evidence in their bodies. Can't risk them testifying about what happened. In early 1943, rumors spread through the camp. 14 women who underwent the most severe operations have been moved to a separate block. They're being measured for coffins. The execution is scheduled. The other rabbits react. They refuse to leave their barracks when guards come for them. They create a disturbance. They alert other prisoners. The camp descends into brief chaos, and something unexpected happens. Other prisoners, not subjected to the experiments, join the resistance. They hide the 14 women. They create confusion about who is who. The solidarity is remarkable in a place designed to destroy human connection. The SS backs down. The execution is postponed. All 74 women remain alive, though many wish they weren't. By May 1943, the surgical experiments officially end. Gebhardt has his data. He's presented findings at multiple medical conferences. He's published preliminary reports. He's defended his decision regarding Heydrich's treatment. But the women remain at Ravensbruck, living evidence, walking testimony. And as the war continues and Germany's fortunes deteriorate, their survival becomes increasingly uncertain. April 30th, 1945. Soviet forces liberate Ravensbrück. The SS has fled. The camp is in chaos. Thousands of women starved and sick, many barely alive. Soviet medical personnel enter the camp hospital. They find standard concentration camp horrors. Disease, malnutrition, evidence of systematic neglect. But they also find something else. Women with identical scarring patterns on their legs. Surgical scars, dozens of them, all similar, all deliberate. The Soviet doctors don't understand at first. Why would prisoners receive multiple surgeries? These aren't medical interventions. These are experimental wounds. The surviving rabbits explain what happened, the doctors, the operations, the infections, the bone removal, and they show the scars as proof. Soviet authorities document the testimony. They photograph the women's legs. They begin searching for records, hoping the Germans left evidence. They don't find much at Ravensbrück itself. The SS destroyed most camp files before fleeing. But the surgical experiments were coordinated with institutions beyond the camp. Reports were filed with the German Military Medical Service, presentations were made at conferences, and those records survived in archives across occupied Germany. Allied investigators pieced together the evidence over the following months. They find Gebhardt's conference presentations, they locate Fischer's surgical reports, they discover correspondence between Ravensbrück and Himmler's office approving the experiments, and they find the spreadsheet, the complete operational log, every surgery documented in clinical detail. The evidence is assembled. By late 1945, prosecutors working on what will become the doctor's trial know they have an ironclad case. Not just witness testimony, though that's compelling. Not just visible scars, though those are damning. But documentation created by the perpetrators themselves. Medical records that prove systematic experimentation without consent. Surgical logs that show escalating invasiveness. Correspondence showing high-level approval. And photographs taken by the doctors showing exactly what they did. The question isn't whether the experiments happened. The question is how to prosecute them. What legal framework applies when doctors become torturers and operating rooms become crime scenes? December 9th, 1946. The doctor's trial begins in Nuremberg, 23 defendants. Gebhardt and Fischer are among them. Oberhäuser is the only female defendant. The charges are specific, war crimes and crimes against humanity, for conducting medical experiments without consent, for causing death, torture, and permanent injury, for treating human beings as expendable research material. The Ravensbruck surgical experiments are prominently featured in the indictment. Count 2 specifically addresses the sulfanilamide experiments. Count 3 addresses the bone, muscle, and nerve regeneration experiments. Prosecutors emphasize these particular crimes for strategic reasons. The evidence is overwhelming, the documentation is complete, the survivors can testify, and the experiments perfectly illustrate the central principle prosecutors want to establish. Consent is non-negotiable. The Chief Prosecutor, Brigadier General Telford Taylor, lays out the government's theory. These weren't battlefield medical decisions made under impossible circumstances. These weren't improvised treatments during combat. These were planned research projects conducted over months with full documentation and high-level approval. The defendants had time to consider what they were doing. They had opportunities to refuse. They had the medical knowledge to understand they were causing harm. And they proceeded anyway, not to save lives, but to generate data. That makes the surgeries criminal, not because they were painful, not because they caused permanent damage, but because they were done to unwilling victims who had no choice and no voice. January 1947. The prosecution begins presenting evidence specific to Ravensbruck. They start with documents. The operational spreadsheet is entered as evidence. Prosecution Exhibit 224. It's projected on a screen in the courtroom. The judges study it, row after row, operation after operation. 74 women. More than 250 surgical procedures. The consent column empty throughout. Defense attorneys shift uncomfortably. This isn't testimonial evidence they can cross-examine. This isn't emotional appeals they can dismiss. This is their client's own documentation proving systematic criminality. Then prosecutors present the photographs. Images taken by Fisher and other camp doctors during the operations. Legs opened, bone exposed, muscle tissue removed, wounds deliberately infected. The photographs are clinical, not sensational. They look like medical textbook illustrations. And that's precisely what makes them so damning, because they show doctors treating living human beings exactly like anatomical specimens. Several people in the courtroom look away. One judge requests a brief recess. The images make the crime viscerally real in a way testimony cannot. But the moment that changes everything comes next. The prosecution calls its first witness from Ravensbruck. Jadwiga Dido enters the courtroom. She walks with a pronounced limp. She takes the stand. Through a translator, she describes her experience. Being selected, being brought to the operating room, Fisher standing over her with instruments, the pain, the infection that followed, the permanent damage to her leg. And then the prosecutor asks her to show the court her scars. Zito stands. She rolls up her pant leg. And the courtroom goes silent. The scarring is extensive, tissue damage visible even from a distance. Areas where muscle was removed, skin grafts that didn't heal properly, visible evidence of multiple operations. Defense attorney for Fisher tries to object, argues this is prejudicial. The judges overrule. This isn't prejudice. This is evidence, physical proof of what the surgical logs describe. The prosecutor asks a final question. Did you consent to these operations? Zito's answer is simple. No, we were prisoners. We had no choice. The defense attorneys face an impossible task. The evidence is too complete, the witnesses too credible, the documentation too detailed. But they try multiple strategies. First, they argue medical necessity. Defense attorney for Gebhardt stands and presents his argument. Germany was at war. Combat medicine required understanding wound infections. The research could save thousands of German soldiers' lives. Harsh circumstances required harsh measures. The prosecution's response is devastating. They bring in expert witnesses, American and British military surgeons, who conducted their own wound infection research during the war. These experts testify that valuable data on sulfanilamide effectiveness was gathered through other means. Observation of actual battlefield casualties, controlled volunteer studies, animal models, none of which required operating on unwilling prisoners. One expert, a U.S. Army surgeon, reviews Gebhardt's methodology and concludes the experimental design was fundamentally flawed. The artificial creation of wounds didn't accurately replicate combat trauma. The bacterial strains used weren't the primary pathogens found in battlefield infections, and the data collected was contaminated by the prisoner's overall poor health and nutritional status. In other words, even if you ignore the ethical violations, the research was bad science. It produced unreliable data. Prisoners suffered, and the results couldn't even be applied effectively to combat medicine. The military necessity defense collapses. Second, the defense tries to argue that some prisoners did consent, that some women volunteered in exchange for better treatment or reduced sentences. The prosecution calls more witnesses. 5 more rabbits testify. Each one describes the same experience. No consent forms, no explanation of risks, no option to refuse. Guards and doctors simply appeared, selected women, and brought them to surgery. One witness, Władysława Karolewska, testifies about being dragged to the operating room while resisting. She describes bruises from being held down. She asks the court a simple question. Does that sound like consent? The consent defense fails. Third, the defense argues following orders. Gebhardt testifies in his own defense. He claims Himmler directly ordered the experiments, that refusing would have meant arrest, possibly execution, that he had no choice. The prosecution's cross-examination destroys this argument. They produce Gebhardt's correspondence with Himmler, letters where Gebhardt proposes the experiments, where he requests permission, where he volunteers his team. These aren't the actions of a man being coerced. These are the actions of an ambitious researcher seeing an opportunity. The prosecutor asks Gebhardt directly, "Did Himmler threaten you if you refused?" Gebhardt admits he did not. "Did you express moral concerns about operating without consent?" Gebhardt admits he did not. "Did you attempt to establish voluntary protocols?" Gebhardt admits he did not. The following orders defense fails because Gebhardt wasn't following orders. He was pursuing his career. By July 1947, both sides have presented their cases. The judges adjourn to deliberate. They face questions that extend beyond this specific trial. They're establishing legal precedent. They're defining where medicine ends and murder begins. They're creating principles that will govern medical research for generations. The deliberations take weeks. The judges review evidence. They consult with medical ethics experts. They draft detailed written opinions explaining their reasoning. And on August 20th, 1947, the tribunal reconvenes to announce verdicts. Judge Walter Beals presiding begins reading the judgment. The document is extensive. It addresses each defendant individually. It analyzes each experimental program separately. And when it reaches the section on the Ravensbruck surgical experiments, the language becomes particularly sharp. The tribunal finds that the experiments were conducted without any semblance of consent, that the subjects were prisoners who had no ability to refuse, that the operations caused severe pain, permanent injury, and in some cases death, that the justification of military necessity was pretextual, that the research design was flawed and the data unreliable, and that the defendants knew they were causing harm and proceeded anyway. The judges emphasized specific findings. The operations weren't medical treatments. They were deliberate infliction of injury. The infections weren't complications. They were intended outcomes. The permanent disabilities weren't unfortunate side effects. They were foreseeable consequences of removing bone and muscle tissue. The judgment continues. It addresses the defense argument systematically. Military necessity fails when the research methodology guarantees unnecessary suffering. Following orders fails when the evidence shows voluntary participation. Scientific value fails when the methodology is fundamentally unsound. And then the tribunal makes a broader statement, a statement that transcends this specific trial and establishes a principle for all future medical research. The judgment declares that voluntary consent of the human subject is absolutely essential, that no military exigency, no state authority, no scientific justification can override that requirement, that the duty to obtain consent rests with each individual researcher and cannot be delegated or excused. This is the birth of what becomes Principle 1 of the Nuremberg Code, the foundational rule of all medical ethics. Consent first. Always. No exceptions. The tribunal announces sentences. Karl Gebhardt is sentenced to death by hanging. The judges specifically cite the Ravensbruck experiments in explaining why execution is warranted. Gebhardt designed the experiments. He supervised the operations. He presented the findings with professional pride. He showed no remorse. He treated human suffering as acceptable research cost. Fritz Fischer is sentenced to life imprisonment, later changed to death. He personally performed many of the most invasive operations. He photographed the results. He filed detailed surgical reports. His youth and lower rank earned brief consideration. But the systematic nature of his participation makes execution appropriate. Herta Oberheiser receives 20 years imprisonment. She administered anesthesia. She monitored patients. She was present during operations. Her sentence is lighter, partly due to her subordinate role, partly due to gender bias in 1947 sentencing. She will serve only 5 years before early release, a decision that will haunt Holocaust survivors. The sentences shock some observers who argue medicine shouldn't carry death penalties, but the tribunal's reasoning is clear and deliberate. These defendants corrupted their entire profession. They made medical facilities places of terror. They documented crimes with the same precision they should have applied to healing. And most damningly, they showed no understanding that what they did was wrong. Even during trial, Gebhardt defended his methodology. He argued the research was valuable. He claimed he was serving German medicine and military necessity. That absence of moral comprehension convinced the judges that execution was necessary. Some crimes demonstrate such fundamental corruption that rehabilitation is impossible. June 2nd, 1948. Landsberg Prison. Gebhardt and Fischer are executed by hanging. The process is swift and documented. Official witnesses attend. The sentences are carried out according to military tribunal protocols. Gebhardt's final statement is reportedly defiant. He claims history will vindicate his research, that future generations will understand he was trying to advance medical science under wartime constraints. History has not been kind to Gebhardt. His name appears in medical ethics textbooks as an example of how completely a physician can betray professional oaths. His research is cited as evidence of what happens when consent is eliminated from medical practice. Fischer says little before his execution. Some reports suggest he expressed regret, though whether for his crimes or for being caught remains unclear. The executions mark a turning point. They establish that medical professionals can be held individually accountable for research crimes, that following orders is not a defense, that professional credentials don't grant immunity from prosecution, and that deliberately harming patients for research purposes is murder, regardless of how it's documented. The Ravensbruck experiments and the trials that followed created modern medical ethics frameworks. The Nuremberg Code, written in 1947, establishes 10 principles governing human experimentation. Principle 1 is absolute and unambiguous. The voluntary consent of the human subject is essential. That single sentence, born from evidence of operations conducted without permission, now governs all medical research worldwide. Every clinical trial, every experimental treatment, every medical study involving human participants traces its ethical foundation to that principle. When you visit a doctor today and sign a consent form before any procedure, that requirement exists because of what happened at Ravensbruck. When researchers must explain risks and benefits before enrolling you in a study, that obligation exists because judges saw photographs of women operated on without explanation. When institutional review boards evaluate research protocols before approval, that entire system exists because the tribunal decided medicine needs external oversight. The principle is straightforward. Your body belongs to you. No researcher, regardless of qualifications or justification, can use your body for experiments without your informed, voluntary, and revocable consent. That seems obvious now. In 1947, it wasn't codified anywhere in international law. The Ravensbruck experiments and their documentation made the principle undeniable. The rabbits who survived faced lifelong consequences: physical disabilities from removed bone and muscle, chronic pain from nerve damage, psychological trauma from operations conducted against their will. Many couldn't work. Some couldn't walk without assistance. All carried visible scars. Several became witnesses in later trials. Jadwiga Jido testified at additional proceedings against lower-level camp personnel. Władysława Karolewska spoke publicly about her experiences, ensuring the crimes weren't forgotten. Others withdrew from public life. The trauma was too severe, the memories too painful. They returned to Poland and tried to rebuild lives in bodies permanently damaged by German medicine. In the 1950s and 1960s, some survivors advocated for compensation from West Germany. The process was frustrating and often humiliating. They had to prove their injuries resulted from experimentation, not normal camp conditions. They had to display scars to bureaucrats. They had to relive trauma repeatedly to receive modest financial assistance. Several rabbits traveled to the United States for reconstructive surgery. American physicians, horrified by what had been done, volunteered their services. The procedures helped, but couldn't fully reverse damage from multiple experimental operations. The survivor community remained connected. They formed associations. They commemorated lost members. They ensured the next generation understood what happened when medicine abandoned ethics. As of 2025, all the rabbits have passed away. The last survivors died in the 2010s, but their testimony remains in trial transcripts. Their photographs remain in archives, and their scars, documented in medical records, remain as evidence of what systematic violation of consent looks like. Here's what makes the Ravensbruck experiments uniquely relevant to contemporary medical ethics. The operations weren't chaotic violence. They were systematic research following scientific protocols. They were documented in professional medical language. They were presented at academic conferences. They were conducted by licensed physicians who saw themselves as serious researchers. In other words, they were medicine in every technical sense, except for consent, and that single absence transformed healing into crime. This matters today because medical research constantly pushes boundaries. Gene editing, experimental treatments for terminal diseases, trials involving vulnerable populations, emergency research where traditional consent may be difficult. Every one of those scenarios requires answering the question the Nuremberg judges confronted. Where's the line? What can medicine never do, regardless of potential benefits? The answer established at the doctor's trial remains absolute. You cannot operate without permission. You cannot experiment without consent. You cannot transform a patient into a research subject without their voluntary, informed agreement. Some argue this principle is too rigid, that emergency situations require flexibility, that terminal patients should have access to experimental treatments without bureaucratic consent processes, that research advancing medicine sometimes requires accepting risk. Those are legitimate policy debates. But the Ravensbruck experiments demonstrate what happens when the consent requirement is eliminated entirely, when researchers decide patients' bodies are available for experimentation simply because the researchers have authority over them, when the justification is abstract benefit to others rather than direct benefit to the patient, when suffering becomes acceptable as long as data is collected. The result isn't medical advancement. It's systematic abuse documented in clinical language. Let me return to where we started, to the courtroom, to the evidence, to the documents that made denial impossible. The surgical spreadsheet, prosecution exhibit 224, 250-plus operations listed in bureaucratic precision. That spreadsheet is arguably the most significant piece of evidence presented during the doctor's trial. Not because it was the most horrific. Other experiments killed more people. Not because it was the most emotional. Survivor testimony carried more human impact, but because the spreadsheet proved systematic criminal intent through the defendant's own documentation. It showed planning. It showed methodology. It showed escalation from infection experiments to bone removal. It showed multiple operations on the same victims. And most damningly, it showed that blank consent column. Defense attorneys had no effective response. They couldn't claim the operations didn't happen. The spreadsheet proved they did. They couldn't claim the operations were emergency medical treatment. The spreadsheet showed they were planned experiments. They couldn't claim subjects volunteered. The documentation showed no consent process existed. The spreadsheet demonstrated that Gebhardt and Fisher understood they were conducting systematic research, that they applied scientific rigor to design and documentation, that they had time to consider ethics and chose not to, and that they believed their work was legitimate enough to record in official files. That belief, that assumption that medical credentials granted permission to operate without consent, is what the tribunal rejected absolutely. The judgment established that being a doctor doesn't give you authority over other people's bodies, that research goals don't override individual autonomy, that documentation and methodology don't transform assault into legitimate medicine. August 1947. The verdicts are announced. The sentences are handed down. The legal precedent is established. And the international community begins codifying the principles that emerged from the trial. The Nuremberg Code is published as part of the judgment. 10 principles. Principle 1 remains the foundation. Consent is essential. But the other 9 principles flow from that requirement. Research must be designed to benefit society. Unnecessary suffering must be avoided. Risk must be proportional to benefit. Only qualified researchers should conduct experiments. Subjects must be free to withdraw at any time. These principles seem obvious in 2025. In 1947, they were revolutionary. They established that medical research has ethical boundaries that law will enforce, that researchers can be prosecuted for violating those boundaries, that consent isn't optional or negotiable. The code influences subsequent frameworks. The Declaration of Helsinki in 1964 expands and refines the Nuremberg principles for international medical practice. The Belmont Report in 1979 establishes American research ethics standards. Modern institutional review board requirements trace directly to the recognition that researchers need external oversight. Every consent form you sign before medical treatment includes language influenced by Nuremberg, risks and benefits explained in understandable terms, voluntary participation emphasized, right to withdraw stated clearly. These aren't bureaucratic formalities. They're legal protections established because judges saw what happens when consent is eliminated. The Ravensbruck experiments, with their meticulous documentation and systematic methodology, provided the clear evidence needed to establish these protections. The surgical logs showed premeditation. The photographs showed deliberate harm. The testimony showed absence of consent. And together, that evidence created a legal framework that protects medical research subjects worldwide. But here's the question that haunts medical ethics even now, 78 years later. The data exists. Gebhardt's surgical reports describing wound infections, Fisher's documentation of bone removal healing patterns, Oberhäuser's observations of patient responses to various treatments, all generated through criminal experiments, all collected from unwilling victims, all tainted by systematic violation of consent. Should that data ever be used? Can it inform modern medical practice? Or does using it, even to save future lives, validate the crimes that generated it? The medical community largely agrees the data should not be used. The experiments were so poorly designed, so contaminated by variables, so influenced by victims' poor health and starvation conditions, that the results are scientifically unreliable. Using them would be both unethical and scientifically unsound. But the question remains relevant because it forces confrontation with uncomfortable realities. Medical knowledge sometimes comes from morally compromised sources. Historical research that didn't meet modern consent standards. Studies conducted on prisoners or institutionalized populations who had limited ability to refuse. Data collected during colonialism from people who had no voice in how their bodies were used. The Nuremberg Code provides clear guidance for future research. Consent is essential. but it doesn't fully resolve what to do with historical data generated before those standards existed, or in defiance of them. Some argue that data should be destroyed, that preserving it honors the crimes, that any use, even for ostensibly beneficial purposes, treats the victims as means rather than ends. Others argue that data should be preserved as historical evidence, not to inform current medical practice, but to document what happened, to ensure the crimes aren't forgotten, to educate future generations about the consequences of abandoning ethics. The tension between those positions reflects the ongoing struggle to reckon with medical research's darkest chapters. Return for a moment to the 74 women, to the rabbits, to the individuals transformed into case numbers on a surgical spreadsheet. Each one had a life before Ravensbruck. Families, aspirations, futures that should have unfolded differently. Jadwiga Gito was a pharmacy student. She was arrested for resistance activities. Her leg became prosecution exhibit evidence. She lived until 1977, walking with permanent disability from operations she never agreed to. Władysława Karolewska was a nurse. She survived 5 separate experimental operations. After liberation, she testified at multiple trials. She ensured the world knew what German medicine did to Polish women. Maria Kuśmierczuk was 16 when she was first operated on. A child transformed into experimental subject, she survived but carried scars, physical and psychological, for the rest of her life. These weren't abstract victims. They were people with names and stories and rights that were systematically violated by doctors who saw them as research material. The trial gave them voices. The verdicts gave them justice, incomplete as any justice must be when the harm is permanent. And the Nuremberg Code gave their suffering meaning by ensuring future generations would have protections they were denied. June 2nd, 1948. We return to where we started, to Landsberg prison, to Karl Gebhardt, walking toward the gallows, to the moment when a surgeon became an executed war criminal. Gebhardt could have refused, could have told Himmler that operating without consent violated medical ethics, could have resigned rather than participate, could have documented the experiments and reported them to authorities who might have intervened. He had options that his victims didn't. He chose differently. He chose to see prisoners as opportunities, to see concentration camp administration as research infrastructure, to see systematic operation on unwilling subjects as acceptable methodology. And he documented those choices in meticulous detail, never imagining that his surgical logs would become evidence at his own trial. That's the final lesson of Ravensbruck. That documentation cuts both ways. That systematic record-keeping of crimes creates undeniable evidence. The physicians who violate consent and carefully record the violations are building their own prosecution cases. The verdict was just. The sentences were appropriate. The executions were necessary to establish that medical credentials don't grant immunity from law, and the principles established by that trial protect every person who encounters medical research today. So here's what I want you to consider. The question I want you to answer in the comments. Think about it seriously because it matters in ways that extend beyond history. If a doctor operates on you without permission, if the surgery is technically successful, if you recover fully, if no lasting harm occurs, has a crime been committed? Or does the outcome determine the ethics? The Nuremberg judges said consent is absolute, that good outcomes don't justify unauthorized procedures, that your body belongs to you and no one, regardless of expertise or authority or potential benefit, can use it without your permission, that the operation itself without consent is assault. Do you agree? Is consent that fundamental? Or are there situations where doctors should be able to act without permission if they genuinely believe they're helping? Where's the line between medical paternalism and medical assault? Drop your answer in the comments. I read everyone, and I'm genuinely curious how people think about this boundary. Because the principle established at Nuremberg, that consent is non-negotiable, still shapes medicine today, but it's constantly tested by edge cases and emergency situations and competing values. And if this analysis gave you insight into how war crimes trials established modern medical ethics, if you understand now why those surgical records from Ravensbruck changed medicine forever, hit that like button and subscribe for more deep dives into the legal and moral decisions that shaped post-war justice. The operating rooms at Ravensbruck are gone. The camp has been preserved as a memorial, but the specific buildings where Gebhardt and Fischer conducted their experiments were demolished decades ago. The physical locations of the crimes no longer exist, but the scars remain in archives, in trial transcripts, in photographs taken by doctors who believed they were documenting legitimate research, and in the bodies of women who carried evidence of systematic medical abuse until their deaths. Those scars, transformed into legal evidence, established the principle that protects you every time you encounter medical research. The principle that no one can operate without permission. That consent isn't a courtesy, it's a fundamental right that law will enforce and courts will protect. The spreadsheet that listed 250 surgeries, the photographs that showed deliberate wounds, the testimony that described operations conducted against explicit resistance, the verdict that sentenced surgeons to execution. All of it traces back to one simple truth that the tribunal recognized and codified: medicine requires permission, always, without exception. And when doctors forget that truth, when they see patients as experimental material rather than autonomous individuals, they stop being physicians and become criminals, regardless of how carefully they document their crimes. That's the line the world drew in Nuremberg, the line that 3 doctors crossed and paid for with their lives, the line that still defines the boundary between healing and harm. It's a line measured not in surgical technique or research methodology, but in a single word: consent. And 74 Polish women, transformed into rabbits in German medical experiments, became the evidence that made that line permanent.